everybody. My name is Van King. I'm a professor at UT Health in San Antonio, an addiction psychiatrist. I decided it would be, really helpful, perhaps to the audience out there and other folks to tell them about how the ECHO program here has really been very helpful to our program. We launched it in May of 2019, and it's currently called the Texas Medication for Opioid Use Disorder Community of Practice. We launched it because we had some grant support back in 2018, 2019 to do many dozens, in fact, buprenorphine waiver trainings in the state of Texas. The reason we did this is because there's a great shortage of these providers, and we're in the middle of a big opioid epidemic, as everybody knows, I'm sure. And unfortunately, when persons get waivered for buprenorphine treatment, they frequently don't prescribe it because they don't have experience with it. They don't have a lot of knowledge about the medication and just substance use treatment in general. So we felt like doing an ECHO, which could bring people together and reinforce some of these treatment practices would be helpful. We knew that there were several hurdles, not only the medication administration, but also just how to set up offices and counseling and things like this. So this was developed to provide regular support and clinical guidance, specifically to new practitioners. And we also wanted to foster mentorship and sort of collegiality in this community of treatment providers. So I think I was going to turn it over to Dr. Papik to talk a little bit more about our experience.
Great. Thanks, Dr. King. Hi, everyone. It's good to be here and to be talking to you about Project ECHO. And a little bit about myself before launching into more information on ECHOs. My name is Jennifer Papik. I'm an addiction psychiatrist, clinical assistant professor here at UT Health San Antonio. And I joined the Texas Mood ECHO in December of 2020, about a year after it launched. And I've been participating, my role has been in helping as a hub team member and helping coordinate the ECHO sessions with finding speakers and presenters and topics to talk about. So, the impact of the ECHO program has been incredible, in my opinion. I think that we reach a lot of different audience members. Our typical ECHO will include individuals from a variety of clinical backgrounds, from prescribers to counselors, case managers, peer recovery support specialists. So it's a wide variety of people in the community. And I'd say on average, we have between 30 to 40 participants in our ECHOs. And this is going to be a combination of people who attend regularly and we recognize their faces and they participate regularly. And then also newcomers, people who have, it's the first time that they've heard of Texas Mood ECHO. So it's a good variety in terms of the audience. And, I think one thing that we will often get feedback about is just how useful it is to be able to discuss real world cases. So after the didactic portion, there is a portion where a case presenter will talk about a challenging case related to providing medications for opioid use disorder. And we discuss it together as a group, not only the hub team, which includes people who are faculty or have frequently prescribed buprenorphine, but also people from the community. And it's always interesting to hear how different practices are done in different areas of Texas. And I think that's one of the most enjoyable aspects for myself is learning about, how to be able to meet our patients where they're at and be able to provide them with the care that they really need. As Dr. King had mentioned earlier, it's also a great way to network with other prescribers, but other clinicians as well, who are providing medications to treat opioid use disorder. So, some of if you're thinking about launching your own echo, some of the things to think about and sort of important lessons that maybe we have learned over time is coordination is key. It tends to be very important with, coordinating with the topic presenters, the case presenters, as well as the hub team members. And so having an organized way of doing this becomes important to launching the echo. The other thing that's really important that we're continuing to work on is getting feedback from our audience members. The way that we do that is through surveys. We send a survey out after every echo, and we compile that feedback. And there have been some really great comments and ways for us to improve, including some of our audience members will suggest certain topics that are quite timely, and we try to do our best to get speakers to be able to speak about those topics. So there's many things that, we're continually trying to improve, but we have had a great time with our Texas Mood Echo. And I think, in terms of what I would tell other people about working to launch an echo, one thing that has been helpful from the get-go, and maybe Dr. King can say a little bit more about this, is being able to work with an experienced team member who has already worked with echo before. And so we really have valued that professional guidance coming from people who have worked on an echo team. So maybe I'll have Dr. King speak to a little bit about that too, if you'd like.
Yeah, absolutely. Working with Andrea Rochat and the ECHO team has been really, really helpful. We didn't know anything about it. I hadn't really participated in echoes before, and so she was able to educate us about the format and what works, what doesn't work from their experience, over many years. And we started by inviting these. Buprenorphine waiver trainees that we had, as well as people that were coming to our yearly symposium down here in San Antonio, we've our project has expanded over the years, and we actually are providing grant funding and facilitating funding for a number of opioid use programs in the state, and those individuals are invited to come to the echoes as well, and basically comprise most of the folks that are coming to the community of practice. And also many of them, as Dr. Papik was saying, provide the cases, real life cases that we discuss after the didactics, and really make it much more compelling to the audience, I think.
Wonderful. One of the things I think about in terms of moving forward and goals for our own echo is continuing to incorporate audience feedback and presenting, getting presenters to be able to talk about relevant topics and trends, for our community, and making it relevant to Texans here and people practicing in Texas. So those are just a couple of things that we're looking forward to coming up.
Yeah, and we're actually building off of this, current echo by we now have an echo that's affiliated with this about hospital-based buprenorphine treatment and induction, and trying to catch patients into treatment at that very early stage, as well as an echo for peer coaches and counselors as well, so to help them with many of the kinds of topics that are important for supporting opioid use treatment on an ongoing fashion.
Great. Well, I hope that gives you guys a little bit of a sense of our echo, and hope that we can be helpful so that you can launch one of yours. Thanks.
Yeah. Great talking to everybody.
Hello, everyone, and welcome to the Super Hub launch. We're so excited to be a part of this and to have been invited to speak a little bit about our experience with developing ECHOs. We are Dent Echo, Dental Education Network for Texas. My name is Magda de la Torre. I am on faculty in the School of Dentistry in San Antonio, and I am a public health advocate. And definitely, I think what Dent Echo has done for us is helped us expand and reach others who need more information on various topics. And our co-director is Dr. Aguilar.
Hi, it's wonderful to be here today and be a part of this Super Hub launch. We're really excited to share also about our experience building this hub and reaching practitioners across communities in Texas. So I'm Dr. Rosalie Aguilar. I'm a co-director along with Professor de la Torre for our newly launched Dent Echo Hub. And I wanted to share a little bit about why we decided to launch this hub. So one of the main reasons we decided to launch this hub was that so that oral health practitioners working in remote locations or underserved areas could have more opportunities to access continuing education, to network with colleagues, and to also meet the needs, the growing needs of the oral health community that they serve. So who is Dent Echo? As I mentioned, we're an interactive peer-to-peer oral health learning community where oral health professionals can discuss challenging cases and solutions with other colleagues in dentistry, all while learning about the latest research and advancements in the field of dentistry. We are working with practitioners to touch on advanced topics, and over time, what we've noticed is that dentistry has changed. It is constantly evolving. And a lot of times practitioners may not have access to that information readily available to them. So that is what Dent Echo is about. We're working to change the way care is provided in these communities through our Dent Echo Hub, through these discussions. And for instance, in some cases, perhaps maybe individuals in one community were not aware of how they could go about providing care to certain patient populations. For instance, pregnant women, a while back, some years back, they were not seen as often by providers, but we now know and we have the guidance showing us that it's important that pregnant women receive dental care. And so we're helping to provide that kind of information to the community where previously there was fear over seeing pregnant patients. Now we are providing that confidence and instilling the confidence for dentists to provide that care to pregnant women through our Dent Echo Hub. And so participants hear from experts in the field, but they also hear from their peers and develop ways to problem solve and to discuss cases where they may have seen a certain individual, a certain case in their community.
So our mission is basically to work with rural community health centers in underserved areas that want to improve their access to care to their patients that they serve. We began working with UT Health San Antonio Echo team in March of 2021. So we're really a new project or a new program. And that's when we started planning our first dental education network for Texas session. We are public dental health professionals in the dental school who want to bridge a gap between the community health centers, dental providers throughout Texas and beyond that may not have the opportunity to attend current CE sessions or current information that from subject matter experts that they can receive from those in our school. And one of the things that we did is we started by reaching out to partnerships. Partnerships are very important. And we linked with the community health centers, dental directors through the Texas Association of Community Health Centers. And we asked them for various topics. We asked them for topics that were of interest to them. What you can see here are two of our advertisement slides and promotional material we developed and used to promote some of our presentations. We've had a session on integrating dental and medical health care and a session on anesthesia and analgesic in the dental practice. We have only had 4 dental echo sessions, and in those, we've already impacted 263 attendees just from April to September. We host the bi-monthly Dent Echo session, so it does take us anywhere from 1 to 2 months to prepare and to make sure that we have engaging presentations so where participants can problem solve and can actually talk about situations and cases that they have had in their community. We do have a pre and post survey, and that includes knowledge, intent, and confidence questions. And this is so that we can measure our outcomes and how effective we are. Along with that, we want to really emphasize that none of this would be possible without UT Health San Antonio Echo team. They have walked every step alongside with us. There's never an email or a question that goes unanswered. So we're very fortunate to have them to guide us.
Now I'd like to talk a little bit about the impact that Dent Echo has had. As Professor De La Torre said, we've only hosted 4 sessions so far, but already we're seeing changes in the individuals that are participating in these sessions. We've hosted topics on managing complex patients, in patients from the geriatric population. We've also had a session on providing care to pregnant women, why it's safe and smart, as you see in the flyer here. And that was actually provided by our state's dental director. We've also had sessions on integrating oral health with overall health. And then we've had sessions focused on anesthesia and how to correctly to provide that to patients so that they have a good experience while visiting the dentist. And these are, again, common things that dentists and the oral health community that are being faced on a daily basis. And so what we've seen thus far is that we've increased career intentions through, for providers who to provide care to pregnant women. We saw an increase through the pre and post surveys and evaluations that we did. We also saw an increase in provider confidence to provide that care. And then intentions also to advocate for the integration of oral and general health also increased. And then the knowledge questions that we asked pre and post, we saw overall the questions that we've asked, we saw an increase, and we saw a significant increase in knowledge for 4 out of those 6 questions. So this is great information that we're seeing. This is great. Not only are we hearing great feedback from the attendees, we're hearing that they love the opportunity to hear from their peers and to be able to share ideas that they've put into practice. We're also learning that, they're hearing about advanced topics that they may not have otherwise had a chance to hear about. Because of course it takes time for information to be disseminated, the latest practices and so on. And so they're really excited about what we've presented so far in our Dent Echo sessions, and they feel that it's advanced their skill set and their ability to really provide exceptional care to patients, the patients they're seeing. So we're excited to see the impact that Dent Echo is having on the community so far.
So some of the lessons that we've learned in this short amount of time is, one of the things is that the concept of partnership and collaboration is key to successful echo sessions. We have not done this alone. We've had many partners who have had a voice in the subjects and how we can conduct this. We also think that we've kept the registration as a very simple process, and that has been very helpful. Along with that, we do provide continuing dental education credit at no cost. And I think that that also is an incentive, because there are many providers in rural communities in Texas that may not have the opportunity to attend as many sessions for continuing education. And also, more importantly, that there is no cost. We do have moderators that are prepared to prompt discussion. We feel that that has led us to have a more active and involved participation, because sometimes it just takes someone to ask that first question to make others feel comfortable that they can then have a voice and speak their mind and ask their questions. We do follow up with attendees by incorporating their evaluation feedback from other programs that we have so that we can improve. The other thing we've done is we've developed a case presentation specific to dental cases. So we modified the one that existed for medical, and we've modified it then to be more pertinent to dental cases as well. I think more than anything, we want to congratulate UT Health San Antonio ECHO team for becoming a super hub. We also are very thankful for everything you've done for us. We plan to continue to grow and to reach even more people, and hopefully at national level, and so that we can see our Dent ECHO program continue to enhance and make an impact in our community. Thank you.
Yes, it's been a great experience to work with a team. I just want to say and add that they've been so helpful in getting our ECHO set up and continuing on also as moderators for Dent ECHO. It's been great to have their support, their technical support, as we continue to provide these sessions to a growing number of individuals. And it's really helped our team just increase our confidence in hosting Dent ECHO sessions. So we're grateful for everything that they do and looking forward to seeing more ECHOs like this across the university, across the state, across the nation, impacting our communities. Thank you.
Hello, everyone. My name is Rodolfo Badilla, and I am the Program Manager for the UT Health San Antonio South Central AIDS Education and Training Center, or AETC.
Hi, I'm Barbara Taylor. I am an Associate Professor of Infectious Diseases here at UT Health San Antonio. I became involved in the ECHO in 2018 when I was trained in ECHO, and then I helped plan our HIV and hepatitis C ECHO as a part of the TACKLE project.
I became involved around 3 years ago now through the AETC. We've launched 3 ECHOs with help of the UT Health San Antonio ECHO team, our HIV ECHO, our HIV telehealth ECHO, and then our Spanish HIV ECHO, which we'll be talking about more today.
So why did we launch the Spanish-English HIV ECHO? So I've worked in the Dominican Republic for the last almost 20 years with a couple different clinics. And one of the clear needs for community clinics and other clinics in other countries and in our own, as has been also addressed by other ECHOs, is expert advice and continuing education about certain topics. And so I knew every time I went to the Dominican Republic, I worked with a specific clinic and would do case conferences and do training. And so I know that this one clinic was really interested in this. And probably in 2019, we talked about it with the clinic leadership about the concept of doing ECHO. It took a little bit for us to sort out all the logistics, and we'll talk about that in a minute. But it really, I think, addresses a gap for places that don't necessarily have continuing education or collaborative learning of this type, and also places that have a harder time getting access to infectious diseases experts or pharmacy experts in terms of learning about HIV. I think the special sauce of this ECHO is the simultaneous interpretation in English and Spanish, which allows us to do outreach to countries in Latin America, to clinics along the US-Mexico border. It's been really exciting.
So planning and implementation was really exciting for both the AETC team and the ECHO team here as well. It was the first international ECHO that they have launched, and we've launched specifically with the Dominican Republic. And was also the first ECHO that required some translational services as well, since we offered simultaneous Spanish to English translation. So approaching it that way, we really had to come up with all the new protocols and really plan this to make this as interactive as possible, knowing that there's 2 languages going on in this ECHO. So the UT ECHO team really helped from the initial providing action item lists, providing checklists, as well as coming up with questions we really need to address when launching an ECHO like this. So they were really instrumental from the beginning in making sure that we covered all our aspects, from having a hub team that we're going to be able to interact with our learning network, and then who to approach as our learning network too, and how to make this all just more cohesive and interactive overall. Even when it came to our didactics and translating that as well, they were really helpful, making sure that there was all culturally appropriate, that Dominican Republic audience would be able to relate to our didactics too. So right from the beginning and all throughout launch, they really helped us, especially with marketing, to reaching new audiences as well.
I think the impact of the program has been really exciting to see. We're one of the newer ECHOs, so we've been in existence just for the last 6 months, I guess. And already, I would say, we're getting really rave feedback from the Learning Network. Just today, we heard from the director of one of the clinics in the Dominican Republic, who said that the providers are really, really appreciative of having this aspect of learning and being able to engage with providers across borders in many different countries around learning about how to deliver better HIV care. I think for me, one of the unanticipated benefits has actually been the benefits to our local providers, our trainees, our ID fellows, and our pharmacy trainees has also been a part of the ECHO. So for them, it's a great opportunity to actually learn about global health. So they're learning about HIV. We know they're learning how to treat it here in San Antonio, but they're also learning some of the challenges of treating HIV in low and middle income countries.
I think things that really stood out to me is the growth. Initially, I feel like we have a good amount of people, then kind of tapered off a little bit. But in this last few months, we've seen such an increase in new participants and new providers in the DR. And even here as well, like Dr. Taylor mentioned, we've had fellows join, we've had pharmacy as well join, and then new providers in the Dominican Republic, which has been great. We've also received some constructive criticism back. I know they are really, really looking forward to the discussion aspect of all our ECHOs. So at one point, they really wanted to make sure that we had a didactic session or portion that was 10 to 15 minutes long and all really focusing on the case presentation and the discussion itself. So we really try to tailor all our ECHO sessions to really make sure that we focus on that discussion and case presentation portion of it.
Yeah, I think, Radel, you bring up a really good point that the real meat of the ECHO is the collaborative learning and the all teach, all learn model. So I think it's one lesson learned is definitely like keep focused on that. The other, I think for us, lesson learned is that the simultaneous interpretation part, as long as you have to have a really good person doing it, and we are very lucky to have him, Hugo Sapien, who does our simultaneous interpretation, but the functionality to be able to switch back and forth between languages has been amazing. For me, that's just an incredible lesson learned. As far as what would we tell others about working with ECHO or how to launch an ECHO, I think the ECHO team is amazing. I just want to echo what Radel said about the ECHO. They're really a great high capacity team to work with and really helped with so many of the logistics. And I feel like there could have been many, many pitfalls that we avoided because we had access to such an experienced team. And they made it really easy.
I completely agree. Like I said, they have a protocol for launching new ECHOs. I think a lot of people get stuck on, well, how do I even do this? I have this idea. I want to make this happen. How do I do this? And reaching out to the ECHO team, they could really give you a step-by-step, a really perspective of how to best do that, and what questions you really need to think about, which is important when launching an ECHO. What's next for our ECHO specifically? I mean, we've had 8 really great sessions. Due to time change, we did have to pause it a little bit, but we are planning a new cohort in March of 2022. So we're really looking forward to the planning and implementation of that really launch in March of 2022 and hopefully keeping that same momentum and spark.
Yeah. And my hope is that our ECHO can continue to grow. I think it really, we have, as Radel said, brought in more folks, and I think that we could expand and have an impact in countries in additional countries. Like we can expand within the Dominican Republic, but there are also a lot of other Spanish-speaking countries that I think could benefit and we could learn from as well. So I look forward to rejoining the bilingual ECHO, Spanish-English HIV ECHO next year.
Hello, my name is Joe Zapata Jr. I'm the manager of academic programs for the South Texas AHEC. And in my ECHO capacity, I am the clinic coordinator.
Hi, my name is Nesvella Eider, and I am the business manager for South Texas Programs, and I am the program manager for the ECHO Clinic. And today we will be reviewing the Community Health Worker Opioid Use Disorder Program, presented by myself and by Joe. So this program was created as the United States is currently experiencing an opioid overdose epidemic. To assist in counteracting this epidemic, the South Texas Area Health Education Center created a program for CHWs on substance use disorders, replicating an adapted version of the University of New Mexico's Project ECHO Opioid Addiction Treatment for CHWs. Based on Project ECHO's anatomy, we pre-assigned help rows and cross-trained staff to cover various positions. Based on planning started in the fall of 2018, all help members attended Project ECHO's 3-day immersion training. Work group meetings were held to create a work plan, discuss participation and future programming. Stakeholder meetings with CHWs practicing in rural Texas was conducted and focused on community awareness, CHW knowledge, and local resources pertaining to addiction and abuse. Information acquired from these meetings were used to refine and modify UNM's curriculum for South Texas communities. Recruitment from our 5 regional AHEC centers began in January 2019. Continuing education credits from DSHS were offered at no cost to the participants. In April 2019, we launched our pilot CHW OUD ECHO. We held a 30-minute orientation session where technical issues were resolved and expectations of the programs were outlined. Our series is comprised of 11 weekly 90-minute sessions. Due to an overwhelming demand, the program expanded into 2 cohorts in October 2019, and on January 2021, we launched our 3rd cohort in Spanish. Each session included a didactic presentation on the 11 topics shown on this slide, and a case study was presented by a predetermined participant. And I will now pass it over to my colleague, Joe.
Thank you, Annette. The participants were asked to complete a knowledge and a readiness to practice questionnaire for pre-post analysis using RACAP. We also collected demographic and geographic data. The online questionnaire consisted of 16 multiple choice questions and 4 statements measuring readiness to practice and preparedness using a 5-point Likert scale, and ranged from unprepared to expert. To retrieve their CEUs, the CHWs completed a session evaluation where we collected metrics on the speaker's performance, feedback regarding the session, and more, using a 5-point Likert scale and yes/no statements. Lastly, on the 11th and final session, we substituted a case study with a participant feedback session. In the session, we asked CHWs of what their opinions were on the program, what they'd like most, and what improvements they'd like to see, and their impressions on the series. The sum of the pilot, groups 1 and 2, and the Spanish cohort equated to 96 CHWs participating in the CHW OUD ECHO program. Our participants were mostly female, Hispanic, with a mean age of 48 years old. As a whole, we calculated a nearly 20% increase in knowledge and a 29% increase in readiness, practice, and preparedness from pre to post. Using SPSS for data analysis, a paired samples t-test was calculated to compare the means. Both the knowledge and the readiness to practice and preparedness assessments were found to be statistically increased above the pre-test means. Additionally, the results from the post-session evaluation found the presenters and the presentations to be seen as highly favorable. It also found that 96.5% of participants plan to use information gathered at the session in the profession. We also recorded a strong attendance rating. Although we did see a slight drop in attendance after the first few sessions, the core group was solidified by our 4th or 5th session. In addition, A post-program session rapid cycle quality improvement plan was conducted by the STA-HIC work group, evaluating the program and its various components, such as the enrollment process, session reminders, session scheduling, and program evaluation. These changes were then implemented into the next round of the series. The impact of the program goes beyond the increase in knowledge and preparedness. The ECHO model proved to be effective at linking subject matter experts and the specialist teams at academic hubs with CHWs and local communities. This created an ongoing learning community where CHWs receive support and develop skills and knowledge concerning OUD. One important point this series made was making CHWs aware of stigmatizing language and replacing it with non-stigmatizing language. So these norms are not perpetrated in care. To reinforce this, the stigma lecture was built into the education series and implemented in a way to have conversations about when and where stigma is seen in communities and in practice, and what individuals can do to combat the stigma and why this is important in order to expand care. I would also like to include some exemplars that were collected from the evaluations and participant feedback session. Some of the most important pieces of validating data can be captured with ones and zeros. We'd also like to include some metrics regarding the environmental and economic impact that we had. If each CHW participant had to drive to the hub location at the UT School of Nursing, UT Health School of Nursing, that would have been equal to driving around the world 13.3 times. It would have used over 11,000 gallons of gasoline, and it would have cost our participants over $25,000 in fuel costs. The CHW OED program has spurred 2 publications and several poster presentations. The first publication was published late last year and focused on the process of replicating, modifying, and evaluating the impact of the opioid addiction treatment ECHO for CHW's program on CHWs practicing in rural and other medically underserved areas of South Texas. The second is a manuscript currently in review that describes the perceptions of CHWs post-ECHO training, including the impact of the intervening COVID-19 pandemic on service delivery and communication. The findings showed that the COVID-19 pandemic caused dramatic changes in how these CHWs operate in the communities they serve and limiting the interpersonal relationships that are vital to the profession. In addition, poster presentations showcasing the findings from this ECHO series have been presented at the 2019 and 2020 IIMS. We also anticipate having presentations at the 2022 SOFI conference and possibly the 2022 Meta ECHO. In the future, we plan to present our CHW OUD ECHO series in Spanish sometime in the fall of 2022. Currently, we are in the process of presenting our CHW COVID-19 ECHO series. If any of you have any questions regarding our CHW ECHO programs, please feel free to reach out. Thank you.
My name is Dr. Paula Stigler-Granados, and I am currently at San Diego State University in San Diego, California. However, I just recently moved. I was previously at Texas State University for the last 4 years, and I am an assistant professor in the School of Public Health. I am currently the principal investigator on a cooperative agreement with the Centers for Disease Control. It's a 5-year agreement to talk about raising awareness with healthcare providers on and around Chagas disease. And within this grant, we were able to write in some support for our ECHO program. I'm very excited about our ECHO program that we have. We actually have 2 programs, one that is focused on providing education about Chagas disease with community health workers. And the second one is focused on providing Chagas disease information for healthcare providers, mostly physicians, but also nurse practitioners and physician's assistants as well. I began working with the UT Health San Antonio ECHO team around 2018 when we started talking about this idea of forming the first ever Chagas disease ECHOs in the country, maybe even in the world. And what we really wanted to do was to focus in on how do we reach this kind of hard to reach audience of the healthcare providers and the community health workers about a topic that they may have never heard of. And so I became the lead of this Chagas disease ECHO that's been highly successful. We started off with maybe only having 20 or 30 participants, and now sometimes we have hundreds of participants from all over the world. And I'm very excited to be linking this interesting information that most people haven't heard about with expertise from people all over the country, and linking them to other people that need this information to help serve their populations. The whole reason I developed the Chagas Echo with UT Health San Antonio Echo team was just to build that capacity for providers and community health workers to, one, just understand a complicated topic, which is what this really is, and two, to again link them to professionals and experts that could help them to understand how to diagnose, screen, and treat any of their patients or people within their community that may be affected by this disease. It's a treatable condition, and it's one of those areas that we just don't know a whole lot about in the United States, but it is definitely an issue that concerns a very large population within our country. And so my experience overall in organizing and leading these Chagas Echo sessions with UT Health Echo team has really just been phenomenal. They have really helped me to organize exactly strategically the information that I want to get out, put it in a way that is really working to provide that place for people to discuss, cases and important areas of interest around this topic. And I just have had such a tremendous experience with them in being able to expand our outreach across the country and across the world. I've really learned from organizing and leading these Echo sessions is that there's a lot of people out there that are very interested in this topic, but they haven't had a place to find really that information that they needed. And so I feel like this has just been a great experience overall, and that working with the UT Health San Antonio team has just been gone beyond what I imagined it to ever be. So what I would tell others about my experience in starting an Echo is, what are you waiting for? This is just a fantastic way to get information out there. It's telementoring. It's also linking people to care and just increasing the breadth of knowledge that's out there about these diseases that are hard to talk about sometimes. And so I would highly recommend working with the UT Health San Antonio Echo team to start your Echo, or to continue working on your Echoes. I've just had such great success with it. We're branching out to California now and making them even bigger. And it's just been overall a wonderful experience.
Good afternoon. First of all, we want to congratulate UT San Antonio Echo program on becoming a super hub. My name is Ludivina Hernandez, and as a community health worker, I am elated to be part of this team along with Marta Castilla, Eduardo Gandara, and Pamela Recto. We were given the opportunity to highlight South Texas AHEC Community Health Worker COVID-19 Echo project. Next slide, please. We want to acknowledge the community health worker COVID-19 ECHO staff and their supporting roles, especially Jana Lesser, director of our South Texas AHEC program. Next slide. Our community health worker COVID-19 work group and presenters belong to the following AHEC regions: South Coastal, South Central, Southwest Border, Mid Rio Grande border, and Lower Rio Grande Valley. Our next slide, please. We want to illustrate our ECHO work group planning implementation. Our team met weekly for 6 months for about 2 hours to plan content and delivery. Once implemented, participating community health workers attended 14 telementoring sessions led by community health workers and focused on 4 domains: introduction to COVID-19, social determinants of health, health equity, and behavioral health and self-care. Each session lasted 120 minutes and included didactic and case-based learning that was facilitated by a community health worker subject matter expert. The AHEC team incorporated a successful role modeling strategy that was especially helpful for those participating community health workers that were initially hesitant to present cases. The mentoring process alleviated their reservations. Community health workers also obtained ESHS CEUs. And now we'll have Marta Castilla that will continue with our presentation.
Thank you, Ludy. So the case-based learning mentorship program for the CHWs was very well received. And in the second ECHO session, the case presentation form was shown to participants. So we actually went through the form, we modeled it, and we wanted to really role model the strategies. So the participants collectively created a case presentation. CHWs in the COVID-19 work group volunteered to assist as mentors to help reduce case presentation hesitancy among the CHWs. This became very well accepted because it eased the nerves of others, because anytime we're going to learn something new, we kind of get nervous. But thanks to the mentors, this was able to be shared. So now I'm going to ask Dr. Eduardo Gándara to share with us the assessment.
Thank you, Marta. So for this project, for this COVID-19 ECHO, we used a pre and post COVID-19 knowledge survey that included 9 questions. Of those questions, 8 of them were multiple choice and 1 wasn't true and false. It also included, the survey included a pre and post readiness to practice piece that included 10 questions and used a 5-point Likert scale. After each session, we did ask participants to let us know how the session went, as well as how to evaluate the speaker. And also at the very end of the ECHO, we had a final session participant feedback where we asked participants what they thought worked, what needed improvement, and that was very well received. So with regards to outcomes for our project ECHO, our pilot cohort included 33 CHWs. 97% of them were female, 75.8% of them were Hispanic, and the mean age of participants was about 50 years. So with regards to knowledge, so knowledge increased, but was not statistically significant. And this could have been due to the small sample size, so that we hope that with this cohort 1 that we have now, we might see a difference. With regards to preparedness or readiness to practice, right? We saw that this increased, and it was statistically significant. With regards to the evaluation of asking CHWs if they plan to use this information, 97.9% of them said yes, that they do plan to use this information. And the attendance rate overall for our ECHO was very good. In addition, at the very end of our ECHO, based on that participant feedback, we conducted a rapid cycle quality improvement evaluation where we took that feedback, we made adjustments to our content, and now we're working, and we made those changes before implementing it with cohort 1. So now I'm going to go ahead and pass it back to Marta Castilla, or Pam Recto, I'm sorry, Dr. Recto.
Thank you, Eduardo. Good afternoon, everybody. Another one of our projects is a mixed method study that examined the impact of our COVID-19 Project ECHO program on the mental health of CHWs. For phase 1, we measured differences in the CHW's depressive symptoms and perceived stress before and after attending the Project ECHO program. And for phase 2, we conducted qualitative interviews to explore how Project ECHO may have influenced the mental health of the CHWs. Next slide, please. So I'd like to report the findings from our first cohort. The CESD mean post-test scores were lower than the pre-test means overall. Although not statistically significant, the mean score at pre-test was above the cutoff score for depressive symptomatology, while the post-test was well below this cutoff score. The perceived stress scale findings showed a statistically significant decrease from the pre-test mean score to the post-test score. The CHW stated that the COVID-19 Project ECHO fostered a sense of community and support, and that also our sessions provided them with additional resources that they could offer their clients. And so I will now hand it over to Ms. Marta Castilla, who will talk about the work that we are doing with the CHWs who have attended our COVID-19 Project ECHO.
Thank you. So as you all might know, CHWs not only want to learn, but they want to share all that they learn, all the knowledge with their peers. So the CHW Health Equity Work Groups, we have 10 CHWs from across South Texas, and they're meeting with the South Texas AHAC team weekly. The work group structure includes two complementary components. The first component is the development of the curriculum, implementation, and evaluation. And the group has chosen the following topics of focus: vaccine, education, vaccine hesitancy, sharing stories about vaccines, and providing outreach information. For the second component, we have integrated something that's very exciting. It's the Chinachli program, a healing program based on indigenous teachings that follow Frey's educational pedagogy. The intent of incorporating the Chinachli program is to develop connection, share personal stories, and dismantle false histories by discovering the authentic stories of their ancestors' strengths and wisdom. So as you see, it says a lot this group chose. So we are just facilitating their development on and sharing, creating of these programs now. But we have two things happening at the same time. The group is getting together and getting to know each other better, making great connections, and then also creating what they're going to share with the rest of the CHWs and peers. So Dr. Gandara, what's next?
Thank you, Marta. Thank you, everyone. We're actually currently having our COVID-19 echo and impact study with cohort 1. That's currently happening. And in addition, following our pilot CHW group for our COVID echo, we now have the health equity work group that is meeting, and that is, like Marta said, meeting weekly for that. We're also in the process of translating our CHW COVID-19 Project ECHO into Spanish with the hopes of being able to launch that program in spring 2022. In addition to that, I just want to highlight some of the publications and poster presentations that have come from this work. So as you can see here, Dr. Recto has been able to publish from this work. And there are several different poster presentations that Marta and Ludi, Dr. Recto and myself and the rest of the AHEC team are hoping to be a part of as they're in their reviews. So again, thank you all so much. Thank you all to our AHEC team. Thank you all for our AHEC team today that presented. And thank you all for the overall Super Hub team planning all of this. It has been a pleasure to be here and to talk with you all.
Hello, everyone. It's a real pleasure to be here. I understand we're doing the ECHO Super Hub for UT Health San Antonio and what that means with our REACH program. My name is Richard Hamner, and I'm with Dr. Potter's group, which is the Texas Mood or UT Health San Antonio. And my specialty in this area is recovery support services. So I was brought in to help develop recovery support services within our opioid use disorder program, the OBOT, and been in the part of the recovery field for almost 15 years now, and looking forward to sharing some time with you guys.
Hey everyone, my name is Sean Wright and I'm a program director for the Recovery Support Services Program at Abilene Recovery Council in Abilene, Texas. And we have been part of the what's referred to as the legacy RSS programs now for a little over 7 years. And so also a person in long-term recovery myself. Some of the other things I get to be involved with, as well as working as a recovery coach and a program director, is as a part of a consultant team with Achara Consulting based out of Chicago. We provide technical assistance to the various RSS youth recovery communities and TTOR and TextMood programs around the state. And then also happy to be a volunteer subject matter expert as part of the hub for the TextMood team. And just happy to be sharing some time with you today and Richard, and what a great milestone.
Absolutely. Oh, thanks, Sean. You know what? One of the things we talk about ECHO, and just we're very new to ECHO in that model. So I can give you a quick backstory. been with Dr. Potter's group about 1 year now. And we came in, we had one echo that Dr. Potter's team was developing and put together, was actually in place. Moved forward a full year now, and we actually are on the verge of 4 different echoes. So we were able to develop this as a recovery support services echo, and really to help educate the community across the state in understanding. I love the format, all teach, all learn. We bring together a group of experts, but at the same time, we have the laymen and the people who are passionate about this work, but are new to the work. And so it is constantly changing, and this is a great format to be able to roll out what the changes are in the field, what the new best practices are, evidence-based practices, and just technologies that are available. So looking forward to doing that. I know one of the other questions has to do with what is recovery support services? And in essence, that's a great question. And I think, Sean, you can probably add to this a little bit, but I know recovery support themselves are individuals that come along and help individuals who are impacted with substance use or mental health conditions and in their challenges. We want to support them in whatever way they feel is best, with addressing their needs and going forward in that community, which creates a lot of process. Sean, I know you had some thoughts on that too.
Yeah, absolutely. So I think one of the really great things about recovery support services is the really broad and kind of dynamic approach that it has, a very holistic approach, right? And so we definitely advocate and support that there's multiple pathways to recovery. So what works for one doesn't necessarily work for the other. In my own lived experience, my experience was more of a solo recovery. I didn't really identify with a lot of the traditional stuff that was going on. And so in hindsight, I wish something like recovery support services and recovery coaching existed at the time, because that was certainly my experience, was just kind of piecing together things from different programs that I came across or learned about, and kind of created this recovery quilt of sorts, if you can get a mental picture of that. And so I think being able to offer that, throughout the state of Texas, and knowing that there's other states around the country that have bought into that paradigm as well, we're getting to see a lot of people that may not have, identified themselves as a person in long-term recovery, or even thought that it was realistic to them because they thought there was only this one way to do it. And if they couldn't do it that way, well, then there was no hope for them. So I think recovery support services in this holistic manner with multiple pathways certainly provides a lot of hope for people that may not have found that otherwise. And I think the ECHO paradigm certainly lines up with that, because again, it's that exchange of learning and teaching back and forth. And that's a lot of that peer and recovery coach relationship.
Absolutely. You mentioned the many pathways to recovery. I think that's one of the great things about ECHO is we're able to look at that. It's a relatively new in the recovery community to realize that there are so many different pathways of recovery and different ways to approach it. And I think with ECHO, we're able to present those, share those, put those out there, and help individuals understand what that looks like, and just how that can have just such a great impact on individuals in the community. And it really unites a lot of the people in providing services and receiving services across the state, and just in this platform, and just their awareness and learning of different services available, right? So I know. Yeah. I know one of the things that they're asking about, people may be interested in, or what are some of the challenges that the recovery support services have, and how can we address those challenges through ECHO?
Yeah, well, I think one of the challenges, right, is Texas is such a big state, and so there's so many remote areas that literally don't necessarily have just quick access to recovery support services. And so, with the forward motion of a lot of telementoring and trying to do things virtually and stuff like that, especially over the last couple of years, it's really been interesting to see, I think, again, aligning with that Texas model, or the ECHO model, how we can learn and teach each other when we're reaching out to these rural communities that may not have anything locally that they can really access, whether it comes to just recovery support meetings or treatment, any sort of holistic support, anything like that, so that now we're able to reach out into those communities, right? And again, we're able to kind of do that teach and learn, where we can educate about multiple pathways of recovery and this whole new paradigm for recovery support services, but we can also learn from that individual, like what are the unique challenges and stuff that they experience in that small community, in that remote area that they're in, because it's certainly going to be a lot different than experiencing recovery in a city the size of Abilene, and then certainly, some of the more metropolitan areas. And so that whole learning, teaching thing, I think, plays out in our virtual interactions that we're getting to see more and more these days.
Absolutely. No, I think other challenges too that we see is just the stigma that comes with recovery support services and recovery in general, substance use and mental health. And so the ECHO platform really helps us we would talk about kind of breaking through the stigma and getting through there and normalizing substance use and mental health. And again, the ECHO platform has allowed us that opportunity to be able to talk about that in those ways. So that's just another a great tool and great resource that we have available to go forward. I know one of the other questions someone was asking is just how do we see this work being able to grow in this particular space? I think we've touched on that some, but just the opportunities that are available to branch out, whether it be just different providers on the treatment side and what that looks like, and learning from that model, looking at the different structures and pieces that individuals in recovery, the challenges that they face, working through housing issues and education and job opportunities, and just being able to impact someone's quality of life and moving forward that way. And I think those are all areas that we can continue to grow and move in. Any other thoughts?
Yeah, I mean, certainly the quality of life, like that's a great kind of milestone to strive for, right? I think that's really important. And I think one of the other things I'm really excited to see as this continues to ripple out and expand is how the conversation will continue to not only reach into remote communities, but just across those kind of those thresholds of the different professions and stuff like that. I've so enjoyed being on some of the ECHO presentations already, where you have people from the clinical side, but then you also have some first responders, and you have people in a hospital setting, but you also have people from the mental health side, and just all these really interesting dialogues that are happening that don't always happen when, especially if you're in a community where things tend to be a little bit more siloed and people kind of keep to themselves and just focus on, what their profession is. But to have these cross conversations and to learn from each other in such a unique way, not only builds a greater understanding, respect and honor for what everybody does respectively, but also how does that, not just really benefit the people that we're trying to serve and that we're trying to help achieve that quality of life when you do have so many people in their network now that are also conversing. So it's not just that one person that has to go, walk through everybody else's door and try to explain their story again or, whatever. But I think if we can just have a broader mutual understanding and appreciation for the work that everybody's doing as part of this ECHO platform, then everybody wins with that.
That's beautiful. When we talk about the community coming together across so many different lines, it's the spider web look where you kind of have, the individual in the middle seeking services and kind of what does that look like and where can they go? They have the challenges with maybe legal issues or health issues, physical health issues, mental health, and all of those. And we can address those through ECHO, and we can help expand it in that way and really develop that recovery-oriented network and system to impact this. And I think that's just the sky's the limit, and the different directions this can go, and the role that ECHO plays in that is